we presented a poster that was on a consensus panel looking at the use of urine drug monitoring and making recommendations about how often and who to test and when to test. What's interesting about this is that there's very little data in the literature, and actually we base our recommendations on weak evidence. So this is not based on solid scientific data. There just isn't data in the literature. So that brings us down to a consensus statement, and which is exactly what we did. And we want to answer the question, who, when, and why, and what to do with the results. Now, part of the reason we need to do this is that so many organizations, both professional and regulatory and legal and law enforcement and other groups, recommend and even in some cases require urine drug monitoring. However, they never specify how often it's to be done or who to test or even how to test. So there's different ways of doing urine drug monitoring that's not addressed in these recommendations and requirements. So we felt that we needed to do a consensus to kind of define this better for the practitioner and help them to go ahead with urine drug monitoring and to make a statement about that. So the first thing would be who to monitor, and we basically felt as a group that we should use the established screening tools such as the ORT or the SOAPP-R, and we did recommend the SOAPP-R, but there are lots of other tools, the Dyer, there's a number of other tools that could be used. Again, we recommended the SOAPP-R as our the tool we'd recommend. To do that, and then to place people in categories of low risk or moderate to high risk based on those screens, and also based on other data too. I mean, not just the screen, but also on your evaluation of the patient, their smoking history, I mean other things that may go into this assessment as well. But once you put them into those categories of low or moderate to high, we felt in the low risk group you should have at least 2 urine drug monitorings that are gas chromatography and mass spec. Or if you're using point of care, which we felt was an inexpensive option, you could do one of those and 1 gas chromatography mass spec in a year. As far as those who are moderate to high risk, we recommended that we do testing quarterly at least. Now, you may want to test a patient much more frequently than that. I've had patients in my practice that I do a urine screen on every 2 weeks until we find that they're reliable, and then we may go to less often. But generally speaking, if they're moderate to high risk patients, you'd want to do this urine drug monitoring on a quarterly basis.